Namaste, I am Manisha Davar and I welcome you to the 9th episode of Understanding Aviation with MD. Today I am here to talk about cabin decompression. On July 2nd, a Japan Airlines flight from Shanghai to Tokyo experienced a sudden loss of cabin pressure, causing the plane to rapidly descend nearly 26,000 feet in under 10 minutes. Oxygen masks were automatically deployed and the flight was diverted to Osaka for an emergency landing. In aviation, cabin pressurization is a process in which comfortable and safe air pressure is maintained inside the aircraft cabin, even though the air pressure outside decreases along with the increase in altitude. This air pressurization is crucial for well-being of all people on board, including passengers and crew members, because this pressurization helps human body function normally. Supplemental oxygen on board are present in form of oxygen cylinders available on board, which are mostly used for medical purposes, and also in form of chemical generators that generate oxygen and are present in the overhead panel from which the oxygen masks drop in case of cabin decompression. Aircraft pressurization system uses a compressor, often part of the engine. This air is then conditioned and regulated to maintain comfortable cabin temperature and pressure. Cabin decompression may lead to hypoxia. Hypoxia is a condition where tissues of a body do not receive enough oxygen, and constant loss of oxygen may lead to damage of organs, or in extreme condition may also result in death. Hence, it is important to make use of supplement oxygen well in time. Signs of hypoxia include shortness of breath, rapid heart rate, confusion, disorientation, and bluish discoloration of skin, also called as cyanosis. During safety demonstration announcement, you may have heard cabin crew mentioning, in case of loss of cabin decompression, oxygen masks would deploy, and you are requested to wear your oxygen mask first and then assist the passengers around you. Now, why is this important? This is important because of the concept of time of useful consciousness. This is the time where your brain acts effectively. Constant drop of oxygen may deteriorate the mental and physical ability of your body, and you may not know how to respond to an emergency situation. Decompression in an aircraft can be categorized into three categories: slow decompression, rapid decompression, and explosive decompression. Slow decompression is usually a resultant of a slow leak around a door seal or a gradual loss of pressure due to a crack in a window, or maybe some system issues. The slow nature of the pressure loss can make it difficult to detect, potentially leading to hypoxia and incapacitation before any warning signs are noticed. Rapid decompression usually occurs within a matter of seconds. A rapid drop in cabin pressure may be due to a small hole in the fuselage or a malfunctioning of pressurization valve. You may expect oxygen masks to fall soon, and you should ensure using these oxygen masks first on self and then assist others. Explosive decompression occurs when the cabin pressure decreases extremely rapidly, faster than the lungs can decompress. This is often associated with a large breach in the aircraft structure. It can cause barotrauma, lung damage, ejection of unsecured objects or people, and difficulty communicating due to noise and fog. Signs of decompression in an aircraft cabin depend on the severity of decompression. It may include a loud bang or thump, a rush of air, a fog or mist in the cabin, a sudden drop in temperature, and the deployment of oxygen masks. While in case of slow decompression, there could be a whistling sound. Passengers and crew member may feel discomfort in ears and not understand why this is happening. There are other signs that indicate that there is decompression. During decompression, a lot of aircrafts have automated announcements that start playing. The cabin lights become bright, emergency lights and indicators come on. The seatbelt signs will also come on in the cabin. However, if you are in the lavatory, you should stay in the lavatory itself. Hold on to a fixed object. Remember, there's an oxygen mask in the lavatory as well. Grasp that oxygen mask and breathe normally. In a rather strange incident that occurred a couple of years ago, cabin crew was so proactive to identify slow decompression because they observed chips packets popping up themselves. This was because of the pressurization change. Cabin crew are very well trained to handle such situation. Aircrafts are modern. They have all the techniques and equipments to handle such situations. All is required from you is to be attentive to the safety demonstration and know when to use this oxygen mask if required. Remember the thumb rule. Wear your own mask first and then assist the fellow passenger. Few incidents from the past include Aloha Airlines Flight 243 that experienced explosive decompression due to fuselage failure caused by metal fatigue and poor maintenance. United Airlines Flight 811 that experienced explosive decompression after cargo door failure shortly after takeoff. In this incident, 9 passengers got ejected from the aircraft. And of course, one of the recent incidents on Alaska Airlines Flight 1282, where aircraft experienced a door plug blowout shortly after takeoff, resulting in explosive decompression. To know more about emergency types and preparedness, remember to share, like, and subscribe these videos. Thank you.